Hi, my name is Jennifer, and my connection to rare is through PKU, diagnosed as 1973 and among the first in the state of Maryland identified by the newborn screen. I would like to say thank you to NORD for affording opportunity to engage with input on this 40th anniversary celebration commemorating passage of the historic Orphan Drug Act and founding of NORD, reminding each and every one of us that every person in the rare disease community has power to shape the future for the better on key critical issues. Specifically, how I reimagine medical foods equity for those with orphan rare diseases and inclusion on the future shaping of the FDA's Human Foods Program. First, I would like to backtrack 10 years' time to NORD's 30th anniversary celebration, for which I attended in person, and as a starting point of reference for gauging progress, speaking to how much I've learned and my response to this challenge confronting the rare disease community. 10 years ago, in 2013, Dr. Jess Taney, chair of the National Commission on Orphan Diseases, and NORD's leadership honoree, stood on the stage of the Mellon Auditorium challenging anyone and everyone to solve the reimbursement crisis for orphan medical foods, medically essential, medically necessary, and originally engineered for patients with rare genetic disorders, beginning with PKU and thanks to the invention of the first dietary treatment ever in 1951. 10 years ago, the nation celebrated the most successful preventative public health policy ever, newborn screening, developed because of PKU, with 2013 also marking the 50th calendar anniversary year of saving babies' lives, yet paradoxically denying the now grown adults as myself and many others access to readily available life-saving nutrition at this half-century mark in time. 10 years ago, Dr. Janet Woodcock, then CDER FDA, spoke to taking measures towards revolutionary progress for rare diseases and engaging the patient in the regulatory decision-making process for accelerated access to innovative therapies at a FDASIA congressional briefing. Yet medical foods failed to be included in this transformative piece of legislation and remained stuck in a 1972's framework without IT modernization. 10 years ago, President Obama gave the keynote address commemorating the 50th anniversary celebration of Martin Luther King Jr.'s Dream speech, speaking to the March on Washington, teaching us that we are not trapped by the mistakes of history, but that we are masters of our fate. At that same time of his Dream speech tribute, I was advocating on Capitol Hill, championing my dream, H.R. 3665, then Medical Foods Equity Act, sadly, which failed to be passed by Congress. And moving forward in 10 years' time, this calendar year 2023, the same proposed legislation still failed to get across the finish line in the last congressional session. In 10 years' time, now in the backdrop of this ODA's 40th anniversary year, those diagnosed with rare orphan diseases and IEM continue to experience access issues to medical foods as they did in the day of Dr. Taney's 1980s Commission report on the orphans, hidden among the many strident voices clamoring to be heard by Congress before the pandemic, and the persistent murmur of those left outside the current healthcare system, left out of FDASIA, left out of the Affordable Care Act, left out of the 21st Century Cures Act, experienced more unexpected and unparalleled health challenges and risks after the pandemic, as with the nation's supply chain shortage and critical formula crisis. And thousands more continually face a nonstop and growing dissemination of misinformation and disinformation in federal programs, such as the Federal Employee Health Benefits Program and Medicare, overshadowed by the cloud of postulated novel uses in the broader category for what is essentially an ancient product. In calculating how much I've learned in 10 years' time, this 40th anniversary year, my response to the extraordinary and disparately burdensome and inequitable challenges is to provide FDA with the regulatory blueprint for excellence, an equity assessment tool to mitigate and eliminate the communication hazards associated with medical foods policy for vulnerable orphans and the accumulation of risk in the wake of these rising new and challenging issues. I answered Dr. Taney's action alert, and in 10 years' time, I went back to school for my master's in public policy, dedicating my final project to crafting a first-in-its-class solution to solving the medical foods problem for the orphans. In 10 years' time, I assumed much legal and health risk with championing medical foods equity and fighting discrimination and coverage at the level of the courts. And sadly, after 7 years of never-ending legal battles and being the prevailing party, I'm still in court due to party appeals and my having no critical consumer protections in law to bring parties, federal agencies, and private insurers alike into compliance with what is safe and just and equitable. And I am not alone. Orphan voices need awareness and elevation. It should not take a tragedy. It should not take 10 years. It should not take 40 years to do what is safe and just, with shifting priorities for science-driven, equitable deliverables and regulatory policy with patients as DEIA partners in the process, and working towards a unified government-wide effort that embraces inclusivity for the orphans and their lifeline medical foods. I applaud FDA efforts for reimagining the Human Foods Program and strengthening the category for critical medical foods in the proposed vision for organizational restructuring and changes in oversight and policy. I see opportunity this year, hope, despite all these challenges, for achieving transformative change through regulatory approach, and believe my proposed ideas for a solution, housed publicly in the medical foods docket folder, have real-world application, specifically speaking to and aligning with the FDA initiative geared towards improving health, equity, minimizing risk, cultural transformation, and making use of innovative technology in reshaping the Human Foods Program. Congress does need to do their part with the legislative fix and providing the FDA with resources to do its job for implementing such changes to the challenges we confront in medical foods. In 10 years' time, and for literally my lifetime, as 2023 also marks my 50th birthday, I am master of my fate. As President Obama reminded us that historic day in August 2013, speaking to the March on Washington, an observance that teaches us that the promise of this nation will only be kept when we work together, similarly invokes the timeless words of NORD's motto, "Alone we are rare, together we are strong." Happy birthday, NORD, and happy anniversary, ODA. And thank you for allowing me to share my vision using my patient's story to turn policy into positive change for the benefit of the greater rare disease community dependent upon life-saving nutrition with medical foods.